the tension in global solidarity when he said there was resentment towards vaccine hoarding and unfulfilled climate pledges. He ended his statement by saying what many people say quietly out loud, and I quote him, quote, "We felt like life in the Northern Hemisphere is much more important than life in the Southern Hemisphere," close quote. This spoke not only to the tension between the global South and Northern countries, but also to the fact that inequalities do not just exist within countries. They exist between countries and are defined by money, which determines who lives and who dies. And this is why addressing inequality is pivotal to the work that UNAIDS does. The successes of the global response to AIDS are also attributable to a multi-sectoral and community-grounded response that at its core regarded the pandemic as being driven by inequalities. HIV has not moved on, but the headlines have. The world is a distracted place, and it's a place where funding for life-saving programs like yours is competing with funding for the insanity of war, which takes the lives of innocent civilians. Even in war, like in pandemics, unequal power dynamics and inequalities determine who lives and who dies. In these times, I don't envy the position that the UN Secretary General, the Director General of the WHO, and the leaders of the conferences like Winnie find themselves in. I do, however, respect the leadership and moral clarity many of them are showing during these delicate times. It's leadership that has always understood that there is intrinsic value to every human life. Every human life matters, regardless of religion, gender, ethnicity, race, sexual orientation, or socioeconomic status. With her focus on inequalities and its many disguises, Winnie has been a consistent, clear, and powerful voice on social justice issues. Many issues that make many people uncomfortable. But her message has been consistent, and in essence, is what UNAIDS is all about. Leave nobody behind. These have always been the ethos of the human rights and gender equality-focused approach of UNAIDS and the global HIV response. Human rights must be upheld at all times for all people under all circumstances. UNAIDS is unique in that it's a UN body that includes communities and civil society as members alongside the member states and its co-sponsors. The policies and directions you set are far-reaching and impact the lives of 59 million people living with HIV and the millions more, including children, adolescents, young women, and key populations who are vulnerable and at risk of HIV due to the gaps that exist. The gaps do not represent numbers and targets. They represent human lives, our very humanity. It's about the adolescent girl in Berlin, the young mother in Gaborone, the inmate in Nairobi, the sex worker in Mexico, and the myriad stories of hope, resilience, and courage. Millions of stories remind us every day that our actions or the lack thereof have real consequences. This meeting happens at a moment when we need to be reminded of the global solidarity that has defined and has saved millions of lives. A response that enjoys the gains achieved from a rights-based, human-centric, and data-driven approach that must remain above religious, ideological, and political pressures, and must focus on inequalities in all their forms. What has been said about inequality for the last 20 years has stayed the same. What has changed is that it has become more politicized, more polarized, and more complex to engage. Some people do not believe that inequality plays a significant role. So it's not just about new information on inequality, but also the task of repackaging the data so that we can dig deeper and speak louder. We need people to tap into the same understanding that you cannot resolve anything, whether it's pandemics, gender inequality, or access to education, if you do not resolve the fault lines of inequality on which they are built. Inequality is at the heart of resolving a number of things in countries like Namibia, a country that is the second most unequal country in the world from an income inequality perspective. Resolving inequality takes time. According to Joseph Stiglitz, resolving inequality is a policy choice. And he's right. It's also true that even if you get the right political leadership and make the right policy choices, it will take time for those policy choices to manifest in better statistics and outcomes in pandemics, HIV, and gender equality. And that is why we have to start now. When we talk about sustaining effective leadership to secure gains, bridge disparities, and expedite progress in HIV prevention efforts, we also talk about urgency. An urgency that has grown over the years, an urgency that is at risk of getting lost in the noise of world events, and an urgency that will only continue to grow. The Global Council on Inequality as a consequence of the visionary global AIDS strategy that the board adopted in 2021, which recognized the need to address inequalities as a primary means to end AIDS as a public health threat by 2030. As a council, we aim to support implementing this strategy and achieving the global AIDS targets agreed upon by member states. And let me recall these three strategic priorities that you set. Number one, maximize equitable and equal access to comprehensive, people-centered HIV services. Two, break down legal and societal barriers to achieving HIV outcomes. And three, fully resource and sustain HIV responses and integrate them into systems for health, social protection, and humanitarian settings. These are the foundations and the core of what the Council and its members equitable and people-centered services, removing societal and legal barriers and integration. Today we are at the midpoint of the strategy period, and we must redouble our efforts to achieve what we set out for 2025, 2030, and beyond. The Global AIDS Strategy was adopted in the shadows of the COVID-19 pandemic. And it's easy to see why you, as the board, adopted the inequalities framework. What happened with the onset of the AIDS pandemic, and by the way, continues to this day, also happened with the COVID-19 pandemic. Today, we take heart that the public health approaches, systems, and investments we made for HIV came to aid the COVID-19 response. Still, we also acutely aware of how those systems were not robust enough and fully funded to have thwarted the pandemic. And this is why, at the Council, we want to ensure that we build for the future, not just for AIDS, but for all future pandemics. The COVID-19 pandemic also showed how the AIDS response is vulnerable and susceptible to the shocks of other pandemics. People living with HIV faced critical shortages of life-saving medicines. Lockdowns posed new risks for women, adolescents, and children. Key populations were not counted when designing responses. We must not let this be repeated, not for HIV and not for any other pandemic. Let me take a few moments to illustrate the link between inequality, HIV, and pandemics. One of the first products of the Global Council is a new analysis led by Council member John Atuguba of the African Health Economics and Policy Association. It shows that countries with higher rates of income inequality have higher rates of death of COVID-19, AIDS deaths, and HIV infection. Another analysis shows that in most African cities, the rates of HIV are significantly higher among the urban poor. For example, in South Africa, people who are poor and living with HIV are twice at risk as those who are not poor. In countries like Ghana, Cote d'Ivoire, and Liberia in West Africa, the HIV prevalence among younger women aged between 20 to 24 is over 5 times more than among men of the same age group. It's clear, inequalities drive pandemics and compromise solutions. Inequalities increase vulnerability to HIV, impede access to health services, and stand in the way of people's dignity. Partial success in the AIDS response, coupled with emerging pandemics, has given rise to complacency that must be reversed. Fresh thinking and approaches are urgently required to reach the 2025 targets and to achieve the goal of ending the pandemic by 2030. Business as usual is not going to get us through the finish line. The same inequalities that are driving the AIDS pandemic are also driving other pandemics. Today, geopolitical factors determine who receives life-saving interventions during pandemics. Today, cutting-edge technologies are available for the rich first and the poor last. Today, there are no global guarantees that newer life-saving technologies will be equitably available for all, even when the AIDS movement is for championing access to medicines. Take, for example, long-acting injectables. They have the potential to transform HIV prevention in the coming years. Yet this new technology is not guaranteed to be equitably. We are back to the start line for negotiating access. We don't have an HIV vaccine yet, but the day there is one, are we prepared to make it available without a fight? And I want each of you to think about this and honestly answer, are we prepared? And then ask yourself this, do we really have to repeat this for every disease, every health issue, every problem, every time? During COVID-19, Namibia mobilized domestic resources and prioritized access to vaccines. Still, we faced a unique predicament that we were financially strong enough to pay for our own vaccines, but we were not politically powerful enough to access them because of vaccine hoarding by wealthy nations. The inequitable distribution of production capacity in the global south leaves significant sections of the world vulnerable. Ironically, even when production capacity exists in the global south, the contracts they are subject to prohibit their use locally. There is widespread lack of trust, and is correctly observed by President Ramaphosa, deep and lingering resentment. Another area of inequality is crippling debt. Today, many countries are servicing debts more than they are servicing their people. African countries paid 79 billion in 2021 to service expensive debt. The world's multiple crises are drawing attention away from health, and countries with low income are facing a double whammy of debt and ill health. Even with political will, the space for action is limited, and today many countries depend on external funding for their AIDS response. How do we begin to address sustainability when fiscal space is limited and demands are multiple? Some may think that countries need to be governed better, prioritize spending, and work on sustainable solutions. I agree with you. In Namibia, an African nation with a strong governance and macroeconomic architecture, most of the spending on HIV comes from the mobilization of domestic resources, which enables the international support from PEPFAR and Global Fund to have tangible outcomes. Sustainability is a key issue to us, but we cannot afford for the international community to walk away at a time when we are so close to achieving success. We really do need all hands on deck. And this is why the Global Council on Inequality, AIDS and Pandemics aims to support the leadership function of UNAIDS. The Council draws on the expertise of a range of experts from the fields of HIV, health, social development, economics, political leadership, and communities. I'm honored to co-chair this council with Professor Joseph Stiglitz, a Nobel laureate, and Sir Mahmoud, a leading global voice on social determinants of health. The goal of the council is to create a policy environment where inequalities can be addressed so that the world can end AIDS and better prepare for and respond to pandemics. As a council, we are advancing 3 arguments. The first argument being the moral imperative for us to address AIDS and other pandemics. Second argument is the economic argument for why we must find new ways to finance and resource pandemic responses, including the HIV response, and newer models of international order that make societies fairer and equitable. The third argument is the self-interest argument that ensures that communities and countries understand why they have to act. Professor Kavanaugh will give more details after I've spoken about how we are structured and how we hope to operate. But let me speak briefly about our objectives. The Council has 3 objectives. The first is to elevate public and political awareness of the link between inequality, AIDS, and other pandemics. We need to make the moral case understood by the polity. Second, to gather, analyze, and utilize empirical evidence on the relationship between inequalities and pandemics like AIDS and COVID-19 to better understand precisely how inequalities at national and international levels drive pandemics, including AIDS, and how pandemics fuel inequalities. The moral case has to be based on facts and evidence. And we've already put some evidence that Professor Kavanaugh will elaborate on. And then the third objective is to generate innovative thinking on strategies, policies, and laws to combat the inequalities perpetuating pandemics and drive the political will to implement them. We hope that what the Council produces will shape the development of the 2025 to 2030 strategy and the post-2030 vision and feed into global efforts to shape future pandemic responses. As a Council, we bring our voices and skills to support an already robust AIDS response that is focused on ensuring that countries, societies, and communities are better prepared for future pandemics. The urgency of this moment requires bolder action, increased investment, and stronger resolve. We believe in the right to health, and the Council wants to play its part. Changing how societies think of themselves and each other takes work and time. As a board, you do not need to agree on every recommendation. And even if you agree, there will be member countries who will not agree with some of your policy recommendations. Remobilizing commitments to fast-track the HIV response is not just about funds and frameworks. It's about bold and accountable leadership that tracks the data and acts accordingly, regardless of who agrees and doesn't agree. This is the leadership we see in the Global Alliance to End AIDS in Children, and it is the leadership we see with the Global Council on Inequality, AIDS, and Pandemics. Nobody, especially not children, should be left behind. When we think about the world and its complex problems, it's easy to feel powerless. And in a way, we are. In one of the many youth dialogues I've participated in, a young person asked a mental health expert what to do when they felt powerless. I'll never forget the answer. And I quote, when you feel powerless, focus on things within your control, close quote. None of you in the room can control the increasingly complex religious, cultural, socioeconomic, climate, or geopolitical ruptures. But you do have control over key aspects of UNAIDS program coordination. So as advised, don't focus on how you feel about things you can't control. Focus on what you can control. I want to thank you for the opportunity to address this board. And Winnie, I want to thank you for your incredible leadership.
So one rule must be to never follow Her Excellency Monica Gingos when speaking to the board of UNAIDS. Thank you very much, First Lady Gingos. I'm going to delve a little bit more into some of the details, and thank you all for giving us the opportunity to speak today about where the Global Council on Inequality, AIDS, and Pandemics is going to go. We are, as First Lady Gingos mentioned, at this time of inequality. But we are also in a time of pandemics, and the idea of the Global Council is that those two things are not unrelated. That just in the last 8 years, the World Health Organization has declared public health emergencies, not just for COVID, but for Ebola, for Zika, for monkeypox or Mpox, and that each of these has not only had deeply unequal impacts, but has also been driven by inequality. That viruses have become outbreaks, that outbreaks have become pandemics, and that pandemics have been prolonged because of those inequalities is what this global council has come to see. And that in that way, AIDS is not exceptional, but AIDS is still the biggest pandemic and the most deadly that we have had. PCB members, let me just be very clear on behalf of the council what the contention here is. It's that evidence shows that there is no scenario in which we can end the AIDS pandemic without making the world more prepared to fight pandemics to come. And that in fact, we will not end AIDS without taking key steps that will contribute toward that broader pandemic infrastructure. At the heart of it, we need evidence-based, effective responses that tackle inequality to fight pandemics. And so I want to talk about a few of those things. First, let me say that as Her Excellency said, the core of inequalities is not just gaps. The argument is not that there are differences or gaps that need to happen, but instead that there are inequalities in which some have their needs served very well, some get their needs met, some have their interests served, but others do not by that same set of arrangements. And so that's what makes it so difficult to address inequalities, is because it requires that we address things where some have an interest in maintaining the status quo. And that's the kind of inequalities that we are seeking to address. Just one example, First Lady Gingos mentioned the new research by the council that was highlighted that shows that income inequality is linked to pandemic outcomes, not just in HIV, but in COVID. And so it's not GDP and not broad poverty within countries, but instead income inequality. Now, one thing we could do to that, and that I think many outside this board often do, is to look at that and shrug and say, well, that is very complex. There isn't anything we can do about that. But it is what's standing in the way of success in fighting HIV. It's why some countries are struggling to actually tackle things. And so what if we could ask two questions? One, what are the more, why are more unequal contexts struggling so much? And two, what would an inequality responsive approach look like? And that is the goal of the council. Same with gender and racial inequality and sexual inequality. What we see is that there are three separate mechanisms so far that we're already investigating. And so to share some of what the council is doing first, we've seen that inequality seems to disable the ability of the state to see all its people. And that in a pandemic is incredibly dangerous. The gender inequality for years resulted in adolescent girls and young women not accessing PrEP and not being made eligible for PrEP. The UNAIDS data shows right now that millions of key populations are not counted in the data around the world, and that makes it impossible for countries to plan effective responses. That in Singapore, for example, in COVID-19, without seeing migrant workers as present in the country, an error was made and it allowed an outbreak to happen. Inequality in this way disables the ability of states to be able to take action. And so that's one piece that we're seeing already and we'll investigate. Second, that at an individual level, inequality increases risk and undermines effective responses. For example, our research has already shown that LGBTQ inequality, as indicated by criminalization, is not only associated with higher rates of HIV, but in bigger gaps. That in countries that don't criminalize, the gap between men who have sex with men and all other men is about 7%. But in criminalized contexts, the difference is 24%. And that shows us that it's not biology, but it's inequality that is driving that gap. And that is what's driving HIV. And in fact, it's happening at a societal level, so that countries that have taken a criminalizing approach have overall, in the entire population, seen lower rates of knowledge of status and lower rates of viral suppression. Inequality is hurting everyone. In one more example, during COVID-19, restrictions on movement proved an effective mechanism in many contexts. But in contexts of high inequality, they proved ineffective. Because what we saw was that the poor, or for example, sex workers, were not able to stay home. They were not able to take those actions. And therefore, all it did was concentrate infections. That's the difference that inequality is making right now. Third, that inequality is politically destabilizing for pandemic responses. Political science research has already shown that countries with high inequality struggle on what is known as policy coordination. Our research shows that countries with high with higher and deeper ethnic and racial cleavages actually adopted World Health Organization approved guidelines for HIV slower. That actually there was a statistical association between how deep were the racial and ethnic cleavages and how quickly did you adopt newer treatment policies. Why? What is going on there? And then in COVID-19, many countries that scored high on measures of capacity struggled to use that incredible capacity because inequality got in the way of coordinating on policy. And then finally, I won't repeat the really clear clarion call that First Lady Gingos made about the international mechanisms, but we see the same happening internationally. We know, of course, that 12 million people on the continent of Africa died waiting for effective HIV treatment after it was already available. But what we don't talk probably enough is what was the impact of that on the pandemic? We know that HIV treatment stops transmission. So how many transmissions happened during that period? It's not just that it was a tragedy that millions of people died and that was a decade of death, but that was also a decade of transmission, avoidable transmission. It's driving the pandemic, not just having negative impacts. And unfortunately, we're right now seeing some of the same things. And so the World Health Organization last month reported that 12,569 suspected cases of Mpox have happened in the Democratic Republic of Congo. That's more cases, now they're just suspected, then more cases than are lab confirmed in the entire rest of the world during that period in which there was an emergency. And yet, as of last month, there were no programs outside research projects to get vaccines into the DRC. Last week, the United States CDC announced to the entire health system of the United States that they should be careful and cautious because there might well be transmission of a new clade coming to the US because we haven't addressed it in the DRC. Inequality drives pandemics. So, over the coming year, the Global Council will be engaged in two big pieces, as Monica was saying. That over this coming year, Sir Michael Marmot will be leading an evidence review on this front with world-class researchers like Imran Valodia from Wits University, Dr. Adiba Kamalrazaman from Monash University in Malaysia, Ingrid Katz of Harvard University, and now PEPFAR. That is one big thing that we will be doing, is to engage in the questions that are in front of us when it comes to inequality. But second, beyond the goals of knowing, the first goal of the Council is to elevate the political and public awareness of the link between inequality, AIDS, and pandemics. And so the goal is to generate actionable ideas. And let me make one important point. The argument here is not that we must wait until inequality is over to end AIDS. The argument instead is that we have to understand how to act in contexts of high inequality and how to build pandemic responses that reduce inequality instead of exacerbating them. That is possible, that is achievable, and in fact, in AIDS, we have shown that we can do that. So in addition to the knowledge review, working groups have been set up by the council chairs. There will be a community-led pandemic response and social protection group that's working on how to understand the mechanisms and the most effective mechanisms through which community-based responses are fighting AIDS, how countries that have not yet adopted sufficient enough community-based pandemic response can do so, and how those can be extended beyond AIDS to fight broader pandemics. A human rights and gender equity group has been set up to examine similarly. How is it that human rights mechanisms can be effective in countering the inequalities that we see? And how do we think about human rights as a key part of pandemic preparedness and response? And a working group on the global economic order led by Professor Stieglitz has been set up as well. This includes, I would point out, many people from the council who have been speaking about AIDS for decades, but also many who have not. And that bringing in of new voices, of bold, powerful leaders who might think differently than the AIDS response does will benefit us. And having them speak about AIDS is a key driver of how do we get the movement that we need and the political attention and the academic attention that we need. The council as a whole will meet in 2024 and will be producing a steady and timely group stream of analyses and convenings. The rule set down to us from our co-chairs is that we are not going to sit for 2 years and then produce a big report that no one will read. That in fact, the goal is in fact to try to generate a set of analyses that are helpful across the coming period. And that is what we've done. Let me thank the remarkable leaders of the council who are giving their time pro bono, over the coming years. And a particular thank you to the governments of Brazil and Switzerland who have been providing strong support. We announced the Global Council in Brazil with the strong support of Minister of Health Trindade, as well as Secretary for Surveillance Machel, and they joined us at the UN General Assembly for an event they sponsored called Think Pandemics, bringing together high-level speakers and ministers who were not only on the stage, but importantly in the audience for a deep conversation that happened there. We're also proud to say that First Lady Gingos was joined by the Ministers of Health of the next two G20 presidents, both Minister Trindade and Minister Bala from South Africa. And innovative and important proposals are coming in the conversations between them and other council members. I won't get ahead of myself. We'll leave those to be, but watch this space. And along with our partners at the Fast Track Cities Initiative, we're really thrilled to say that the governor of Bangkok, Chad Sittipunt, joins them as a leading political voice thinking about the urban response alongside former Prime Minister Helen Clark. Members of the PCB, the AIDS response has always been where we have done some of the hardest work. We have done so through data and evidence, and we've done so through smart politics. And the aim of the Global Council for Inequality, AIDS, and Pandemics is to do exactly that. Thank you very much for your time.
Well, thank you, Monica Gengos, and thank you, Matt, for the presentations. The floor is now open for comments. WHO, followed by Brazil, please.
Thank you, Chair. Your Excellency, First Lady Gengos of the Republic of Namibia, UNAIDS Executive Director, Dewini, distinguished program coordinating board members and observers, dear colleagues and friends. I am pleased to make the following statement in two capacities. First, on behalf of all co-sponsoring agencies, and secondly, as a member of the Global Council on Inequality, AIDS, and Pandemics. Thank you for your inspiring words. Our world is rapidly changing. Some of the change are towards progress, some are not. We increasingly face new levels of complexity in all aspects of our work. Inequalities and inequities continue to hamper our multi-sectoral responses to HIV, humanitarian emergencies, and disease outbreaks. The urgency and multiplicity of contemporary emergencies means we need to be more efficient working with and through partners. Life-saving and life-preserving commodities, including condoms, harm reduction, diagnostics, vaccines, and treatment, are unequally available around the world. Social and economic failures continue to slow progress and widen inequalities, with the most marginalized and underserved communities bearing the brunt of market and health system failures. We need to further amplify the global leadership voices of the Global Council to create approaches and responses that address the ongoing inequalities of HIV and other global epidemics, outbreaks, and emergencies. For example, the Democratic Republic of Congo has recently reported more than 700 deaths from clade 1 Mpox, the more deadly strain of Mpox, yet there are no vaccines readily available in country. We need global solidarity around sharing commodities where they exist and the sharing of technology to ensure the most in need are reached through local production and other means, especially when it comes to commodities that have been supported through research and development with public financing, and as we saw during COVID-19 pandemic. We need greater attention to services and programs addressing gender-based violence, sexual and reproductive health and rights, comprehensive sexuality education, and harm reduction. We must intensify our efforts to bring down new HIV infections among young women and adolescent girls in sub-Saharan Africa and consign gender inequalities to history. The Global Council needs to continue to loudly say the names of key populations: gay, bisexual, and other men who have sex with men, transgender people in all their diversity, sex workers, male, female, and trans, people who use drugs, and people in prisons. We must not allow these and other communities to be made invisible, given the leadership and essential contributions to the response. Each day, 1,700 lives are lost from HIV-related causes, and 3,500 people are infected, with many not knowing the status or having access to treatment. And 9 million of the 39 million people living with HIV have yet to start treatment. 800,000 of them are children and 400,000 adolescents. Our work on HIV is far from over. Co-sponsors urge the Global Council to continue to be vocal and to strengthen links with communities, including people living with HIV, young women, and key populations. We need more leaders speaking loudly on HIV and on the key communities that we serve. I thank you.
Thank you, WHO. Brazil to be followed by NGO Africa, please.
Thank you, Chair. First of all, I would like to say that we are very proud to participate from the scratch in the Global Council of Inequalities, AIDS, and Pandemics. I would like to begin by underscoring Brazil's unwavering commitment to the rights of those living with, at risk of, and impacted by HIV. Our response to HIV is a state policy, deeply rooted in our Constitution, which declares health as a universal right, determining that the state is responsible for the fulfillment of this right. This is further reinforced by a federal law that ensures free HIV treatment in our health system, creating the basis for a comprehensive and self-sustaining program. A critical aspect of Brazil's HIV response is the recognition and the encouragement of the key population activism. Their ongoing involvement in shaping and implementing public policies is indispensable. From the onset of the HIV epidemic, Brazil's response has been guided by the principle of solidarity, a cornerstone from strengthening our democratic society. This solidarity emerged from community-based efforts, focusing on prevention and support for people living with HIV, and this experience forms the backbone of our commitment to achieve universal access to treatment, upholding the full enjoyment of right to health. Brazil is also determined to eliminate mother-to-child transmission of HIV and reduce syphilis and hepatitis B transmission. We focus on municipalities with the population over 100,000 people, establishing indicators that reflect our efforts towards these goals. By sharing this experience with other countries in the South America, Mercosur countries, we aim to enhance regional outcomes and eliminate mother-to-child transmission of HIV. In our view, leadership in the AIDS response is about creating comprehensive and sustainable HIV strategies. These are grounded in the promotion and protection of human rights, and as well in the dialogue with civil society, investment in research, and the timely adoption of the new health technologies. Since 2005, Brazil has been striving to achieve the first of the 95-95-95 targets for HIV diagnosis by 2025. The Ministry of Health annually distributes over 12 million rapid HIV tests, mainly in the primary healthcare settings. To promote self-care and prevention, more than 1.3 million HIV self-tests have been distributed last year. We seek to further encourage self-testing and overcome existing structural obstacles to early HIV diagnosis, particularly among vulnerable and young populations. We are proud of our national response impact and are now addressing remaining challenges, such as increasing access to prevention technology, such as PrEP, Our ambitious goal, it's a 300% increase in PrEP availability by 2027, enhancing prophylaxis access and expanding differentiated care strategies to benefit those most in need. In conclusion, Brazil reaffirms its dedication to scaling up HIV prevention as part of accelerated comprehensive response. We aim to meet global and national targets to eliminate HIV/AIDS as a public health threat by 2030. By making new prevention methods accessible to high-risk groups, we can more rapidly reduce new infections. We call on the international community to strengthen the global HIV response, demonstrating our collective commitment to this crucial health challenge. Thank you.
Thank you, Brazil. NGO Africa to be followed by Côte d'Ivoire, please.
Thank you, Chair. I speak on behalf of the NGO delegation. Esteemed Madam Gaingos, both of us hail from Southern Africa and share a common passion to save our continent. Thank you for your inspiring words you have shown us today, but more importantly, in your daily deeds. What leadership can be, should be, and must be. Leadership is never just about telling our constituencies where they are at. Populists increasing do that daily, magnifying and multiplying their followers, confusion, prejudices, as well as anxiety. Leadership means brave and bold and stepping out in front of a constituency, making it clear that no matter how daunting the future, there is always a path that can take us there together. Leadership means speaking about decriminalization when others are criminalization, or rather criminalizing. It means speaking about human rights where others are denying and persecuting our communities. Leadership recognizes our communities in all their diverse, where others seek to erase us, both in our word and deeds. It speaks about fully funding the global AIDS response, which includes fully funding the UBRAF, where others are cutting back or playing political games with funding. It strives to achieve our societal and service enablers, which are the 10-10-10 targets, as others boast about the 95-95-95 ones. Leadership allows community-led responses and recognizes that nothing about us is without us. With less than 80 months to go until 2030, and with the clock ticking for our communities, we need leaders who will work with us to support populations most vulnerable to new HIV infections, who will strengthen community-led responses that meaningfully engage and reach these communities, and who will lead communities' ownership and seek for the domestic funding for the AIDS response. As a young person living with HIV from Zambia, our community is ready to take the leadership role and be valued partner in finding solutions together on accessing treatment and differentiated care. We are no longer in the shadow. Your political leadership, your investment in communities, and the UBRAF can ensure end the pandemic. ICASA 2023 was clear on the importance of inclusive community voices, especially youth voices, where over 70% of Africans are under 30 adolescents and young people are living with HIV and face challenges in accessing treatment, care, and differentiated care. Let's not leave marginalized population in the shadow. We need to engage these audiences so we remain open-minded to innovative approaches. Thank you, Chair.
Thank you, NGO Africa. Côte d'Ivoire is next, please.
Merci, Monsieur le Président. C'est avec un honneur et un plaisir pour la Côte d'Ivoire de s'exprimer au nom du groupe africain sur le leadership dans la...
in the AIDS response. The African group would like to applaud the efforts made by UNAIDS and its support in our different countries, and also recognize the commitment of the leadership of the executive director, Winnie. Of course, the fight against AIDS requires the commitment of the leaders of our different countries. And whether it be the issue of mobilizing our local communities against AIDS or mobilizing financial resources at an international or at a local level, we always need strong leadership in order to be able to achieve considerable results. The African group is of the view that the experiences that have been shown in numerous countries have demonstrated that when state leaders or leaders from communities or religious groups, in public and private groups, are at the very heart of the fight against HIV/AIDS as part of the multi-sectoral national response, we see ownership grow and better involvement of community actors, healthcare providers, civil society, and seropositive individuals, as well as international partners. This involvement, of course, has a positive impact on the results, with better access to healthcare services, a reduction in the number of new infections, a sustainable maintenance of care for patients, and a reduction in the mortality linked to AIDS. The involvement of communities is therefore essential, and the subject to which the 36th World AIDS Day on the 1st of December 2023 was dedicated, well, allow me to just recall it here, it was give leaderships to communities, and that was an important theme. The African group encourages all African leaders to make the fight against AIDS their own and their priority in their respective states, to leverage the necessary resources and to implement the African Union's roadmap for shared responsibility and global solidarity in the fight against AIDS, tuberculosis, and malaria. The objectives of eliminating AIDS by 2030 in the world and in Africa are related to this. We support the activities of the executive director, and on behalf of the African group, I would like to thank you very much for your kind attention.
Kenya's next, before about the NGO North America, please.
Thank you, Chair. I'll speak on behalf of Kenya as well as a member of the Council. The Global Council for Linking Inequality in AIDS and Pandemic is a vital reminder of our collective responsibility. Chair, I must admit that in this council, it's about breaking the silence and confronting the uncomfortable truth. In the HIV response, we are at a phase where we are talking about sustainability. We are asking countries to prepare, to invest, and to sustain the gains that have been invested in the last more than 4 decades. But in this discussion, we are aware that most countries lack the capacity, the human resources for health, the finances, knowledge about commodities and the market that shape those commodities. They also lack strong community and health system that can take in the HIV response as it is today. But this discussion that is happening today does not reflect on the truth and the position of the yesteryears. The HIV response started on an equal pathway. Indeed, today we are here because of the strong community-led action that stood up and required people seated in a room like us to redefine and redesign the HIV response. As such, Chair, the UNAIDS has led the world to break the silence. And this silence is uncomfortable for most of us. But the reality is that this silence, if it continues, it is going to derail the progress we have made today. It is therefore crucial for us to agree that moving forward, we shall examine every step of the future of the HIV response, wearing a lens of inequality, not just between countries, but even within countries, between subpopulation and between geolocations. We have spoken a lot about what COVID-19 has taught us, that when two pandemics meet, they rest somewhere among the marginalized, those discriminated against, those living in poverty. A simple tool and a piece of cloth redefine the difference between those who had masks, those who had sanitizers, and those who were living in crowded conditions when they were asked to isolate themselves. In these realities, when households were broken down due to lack of resources to feed their families, women, especially those in poverty, bore the highest burden. We saw this again in the HIV response. Allow me to share with you my part in short, why this inequality is not far-fetched. My first assignment in Kenya, having moved from Geneva, was during COVID-19. And a woman from the slum areas of Nairobi traveled more than 60 kilometers and walked into the council office because she had heard me speak about HIV the previous day. She was not allowed to see me because she could not see people. We were talking about restriction and not allowing visitors in. But she waited for 8 hours. I had no idea somebody was waiting for me. And this woman, when she had a chance to see me, she said that she was an entrepreneur who was having a business to clean offices. Those offices had closed down, and her and her 2 children had remained 2 spoonfuls of flour to make porridge for the day. The previous night, she had watched me speaking about HIV, and the only business that was available to her to feed her children was something that came during COVID-19 of what they were calling home-based sex work. And having watched me, she realized that she would come to people who are dealing with HIV to help her with food. It is this reality that made me realize that the COVID-19 redefined the HIV response more than we can ever think. To date, we are still struggling with the design that we did in the early HIV response, where we have deeply negative pathways, where countries are unequal, continents are unequal, and we had a likelihood of creating ripples of mistrust that left subpopulations behind. It is in this context, and that lady who came to my office, that this discussion must go on, and that we must all come together in global solidarity, just like we did during the start of the AIDS response, to end this inequality that will come now as we move forward in the next frontier of the AIDS response. I submit.
Thank you, Kenya. And I invite the NGO in North America.
Thank you, Chair, and thank you, First Lady Gingos. As a queer, gender diverse settler immigrant, long-term survivor living and thriving with HIV, I deliver this statement as the outgoing North American delegate. I now call the Treaty 13 Dish with One Spoon Territory, Turtle Island, also known as Toronto, Canada, home. My Chinese name is Xixing, which means to think and act honestly. I share this as this is a long-standing practice of Indigenous peoples, to situate one's roots so those whom we greet all establish respectful and reciprocal relationships after. I know Namibia is the ancestral home to the San, the Ova Jimba, the Ovatu, and the Ova Himba. And I wish to offer my utmost respect to the traditional custodians of lands which have faced colonial extraction as well as historical and ongoing genocides, either through rights violations, pillaging of environments, or an unwillingness to recognize the UNDRIP by member states globally. First Lady of Namibia, Gingos, I'm glad that our outfits today somehow just match for some reason. The delegation expresses sincere gratitude for your leadership for championing human and socio-economic rights, dismantling inequalities, and supporting people with diverse key and priority population groups through closing in on the 2025 testing, treatment, and virus suppression targets nationally, innovating a pandemic response that maintains unity and solidarity, countering gender-based violence, and establishing a pandemic response and social protection initiatives such as the Co-Feed Namibia to address food insecurity, as well as calling for the repeal of Namibia's sodomy laws so the basic human rights and health of LGBTQ+ communities can be safeguarded. Your work is rooted in a feminist and intersectional approach in addressing HIV and AIDS, one which UNAIDS Executive Director, Dr. Winnie Byanyima, has called for. This much needed decolonized approach to funding and program delivery counter the traditional top-down neo-colonial ways of addressing HIV and AIDS, and indeed is a solution which all stakeholders present should consider. To honor the leadership as exemplified by both of you and Winnie, two strong African women leaders, I would like to offer and sing a short song called the Strong Women Song, which I've been taught by one of the most neglected groups within the HIV response, Indigenous women and trans women living with HIV, which are left behind within the global HIV response. And even within the global movement, as this group is rarely raised by key population networks in various fora. The song originated from Indigenous women who sang the song to support a fellow Indigenous peer who was experiencing incarceration and was taken out of an Indigenous sweat ceremony because she was going through a hard time. For Indigenous people, the drum beat signifies the beat of the heart, which sustains life and healing. It is the hope that all in attendance will recognize the oneness within all humanity, and that all can offer support to courageous, authentic leaders who are tasked to address an increasingly complex and challenging HIV response, where the rights of people living in HIV and most affected by HIV, as well as the lives of children, women, TS, LGBTQ+ people, and civilians are violated and blind eyes turned on the ongoing crimes against humanity and injustices. So I'll just sing very briefly.
Thank you. But let me interrupt you for a second. While we appreciate that you do offer the song, this is not the problem. It's the United Nations board meeting at last. Would like to invite you to do this at the reception so we can all enjoy that at that space and do this intervention.
Dankeschön. Thank you, Chair.
Yeah, thank you. So thank you. Russian Federation is next, please.
Уважаемый председатель, уважаемые коллеги, хотели бы поделиться своим вкладом в борьбу с ВИЧ. Возможно, Совет
HIV/AIDS, and that the Council have taken into account our work in its work. In this year, we considered our multilateral cooperation with Russia, fighting different variations of HIV. Like the executive director has said, we support her approach. Our collaboration with the WHO as part of the high-level working group covers strategic issues, for example, prevention, treatment, and statistics. In this year, we will celebrate the work that we've been doing up to 2025. Are counting on continuing our collaboration with the BRICS countries on fighting against HIV/AIDS and other viral infections. As part of our collaboration with countries from the African continent, we are continuing bilateral collaboration, including the preparation of doctors and those working in treatment and prevention of HIV/AIDS. Russia has taken a decision this year to share some $90 million to strengthen the collaboration in humanitarian and economic work in those countries and to help countries with their debt. It's to the tune of $23 billion. We've heard in a number of statements from the morning and statements from Namibia, for example. This will help us to reduce the financial burden in those countries. It will allow us to spread financial resources to different areas, including the health sector. We are not happy with the rhetoric and political statements from a number of countries. The countries and their representatives are continuing to further the conflict in Ukraine and, of course, are ignoring the major colossal financial resources that are attributed to creating and furthering the war in Ukraine, which of course could go to other areas such as sustainable development and health. For some 10 years now, we have supported the refugees from Ukraine. We've given them free medical service, testing for HIV/AIDS, diagnostics, and we've provided social care for them. Separately, like to inform you about the current situation, international consultations of the Forum of NGOs, and the NGO Forum rather, which is working on HIV/AIDS. Representatives from the delegations of UN/AIDS and the Russian NGOs participated in that, and I would like to thank the UN delegation for allowing us to actively participate. We'd also like to note the active dialogue, and we hope that the active dialogue will continue and we'll have regular meetings with UN/AIDS. We cherish the hope that these fora and these decision-making areas and the format of our group will allow us to express our views and bring our results, both in terms of practical areas, medical, as well as advancements in science and medical research, prevention, working to fight HIV/AIDS, comorbidities, and treat other issues. I thank you very much for your kind attention.
Thank you, Russian Federation. 2 minutes next, please.
Thank you, Chair. And thank you, Your Excellency, First Lady of Namibia, Monica Gingos, for an inspiring and passionate talk on the impact of inequalities on the work of the Global Council on Inequalities, AIDS and Pandemics, and the analysis you provided. My constituency, France, Liechtenstein, Monaco, and Germany, really applauds your and others in bringing this important issue for discussion to the board. And thank you for your engagement and for your co-chairing of the Global Council and the important work the Council is doing on inequalities, AIDS, and pandemics. And also thank you, Matt, for your passionate presentation on the work of the Council. And you illustrated to us so vividly through your words and also through the video how inequalities can impact people, populations, and countries, and how inequalities exist within countries and between countries and regions. And thank you also to my colleagues here for the examples brought to us today in the room, for example, from my colleague from Kenya. And we have heard about important global inequalities, and I want to underline one point made by Your Excellency that as member states, we also have it on our hands to ensure inequalities in our own countries are reduced, that legal barriers are removed, discriminatory laws are changed, and that the health system is set up in a way that ensures equal access to HIV services for all population groups in need. And let me just reflect on another aspect that Your Excellency have also alluded to. An inequality we have in our hands to reduce in our own countries. It is ensuring that our young people, girls, boys, trans, gay, lesbian, queer, do not lack access to the knowledge and skills to protect themselves from HIV and other STIs through the provision of comprehensive sexuality education and unhindered access to sexual reproductive health and rights. The combination of knowledge, education, skills, and rights is currently the best vaccine against HIV that we have in our hands. Let me close by thanking you again, Your Excellency, for your inspiring, insightful talk. We appreciate your call for global solidarity and your engagement in the work of the Global Council and in providing political visibility to this important work. We wish the Council all the best for their work, and we look forward to the recommendations of the Council and how these can best feed into the development of the next Global AIDS strategy. I thank you.
Thank you, Germany. Frontline AIDS to be followed by Manara.
Thank you. Thank you, Chair. And I want to begin by saying a sincere thank you to the First Lady for her address, which was both sobering and activating. In the context of wider discussions about UNAIDS remit, some have queried whether UNAIDS should be engaged in areas such as pandemics. The presentations leave us in no doubt that UNAIDS, along with the community and civil society actors that have led the response, have much to contribute to discussions on future pandemics. And indeed, we have a major stake in the decisions that are currently being taken. I want to flag that the latest draft of the Pandemic Accord does not include a commitment to end the existing pandemics of HIV, TB, and malaria as the foundation to building future pandemic preparedness. And that's despite the fact that language on this was hard fought for in the high-level political declaration on PPPR just 3 months ago. It also does not include a pledge to leverage the lessons learned in responding to HIV in order to shape future pandemic responses. It doesn't reference people living with HIV as being disproportionately affected by pandemics, and it doesn't name or note the vulnerabilities facing key populations. Building on the Let Communities Lead theme, which was a central part of this morning's discussions, it does not acknowledge the essential role of community leadership and community-led responses in PPPR efforts. This should be a serious concern for every one of us, and it underscores the vital importance of UNAIDS actively engaging in the Pandemic Accord negotiations and in wider discussions on PPPR and the global health architecture. Until the accord is finalised, I invite UNAIDS to collaborate closely with my organisation, Frontline AIDS, and with the many other civil society and community organisations that are working day and night to secure a pandemic accord that will acknowledge, build on, and strengthen our work to end AIDS, rather than one that distracts from and ignores our collective goal. Thank you.
Thank you, Frontline AIDS. Minara is next, please.
Yeah, thank you, Mr. Chair. And thank you for this opportunity to be here with you. I'm Eli Araj. I'm coming from Lebanon. I'm the director of the Middle East and North Africa Harm Reduction Association, but I'm here on behalf of the MENA Edge Coalition. So as I mentioned, I come from MENA, and we all know about different crises that are hitting my region. Being a representative of a regional coalition, I must inform you that we started our fight against HIV in the early age of this pandemic, a 40 years path during which we discovered many other social illnesses that our societies live with: stigma and discrimination, restrictive laws, lack of political commitment, poverty, etc. We built our leadership with the support of UNAIDS, WHO, and other UN agencies and international NGOs. We supported key populations and their leaders to create, without fear, their own safe working mechanism, and they are now involved in decision-making processes. Yet, we are still facing major problems, particularly rising HIV prevalence and an epidemic that is concentrated among men who have sex with men and people who use drugs. In our region, the scarcity of services is also a barrier, especially for women, female sex workers, transgender, youth, and people living in humanitarian settings. Whenever there are services, they are still way behind the comprehensive package, and the coverage is very weak. Key populations in my region are criminalized, incarcerated, and marginalized even from the health settings. And now, with the closing of the UNAIDS RST MENA, we face a loss of leadership, which brings further threats, including one, greater difficulties with domestic funding mobilization, already difficult due to insecurity and other crises. 2, a worrying signal to other international partners about the level of commitment to tackling HIV in this region, and a very real risk of a cascading retreat of resources and leadership from the region. And 3, the lack of civil society and community voices from the MENA region on the Global Fund and UNAIDS governance and decision-making structures. Based on this leadership gap, I call for the following actions. 1, facilitate systems, mechanisms, and collaborations to safeguard against diminishing leadership and commitment from international partners. 2, increase HIV funding to MENA with a focus on supporting civil society organizations, including commitment to continued catalytic funding to the region. And 3, increased support for the leadership of civil society and communities in the MENA region, in particular our inclusion in the UNAIDS PCB. Mr. Chair, Madam Executive Director, dear colleagues, I believe we still have unfinished business. Don't leave the MENA region behind. Thank you.
Thank you, Manara. Thank you also for all the comments that were provided, and thank you again. Also, she has already disconnected, I think, Monica Gangos for her really rousing remarks. And I would now like to give the floor to Winnie for some closing remarks before we break. Thank you.
Thank you, Chair. And I thank very much Her Excellency First Lady Monica Gangos and Professor Matt Kavanagh and the other members of the council who spoke, Jerome and Ruth. Thank you all delegations who have contributed some thoughts and give support to this important work. The inequality lens is a powerful tool for us to understand and fight AIDS and other pandemics. It takes us into the world of rights and claiming rights, claiming equality, the right to health and life for all people, the right of equality under the law, and therefore removing those laws that discriminate against some people and harm them, the right to equal access to life-saving technologies, the right to equality for girls and women in their societies. So the right to resist informal laws that make them inferior in their own societies and that allow discrimination against them. These are rights, and our work to fight and end AIDS is about claiming rights and equality. The Council has been engaging on our behalf, all of us, at Anga. They made an impact there. They are putting evidence, they are putting their knowledge before the negotiations of the pandemics treaty. They are engaging with the G20 through the leadership of Brazil, and they will continue to the leadership of South Africa of the G20. Those are two important opportunities of leaders from the South, leadership from the South, to be able to also to use that opportunity to drive against inequalities in the global system that work against the right to health. I would want to keep you informed about the progress of this work. I thank very much the Swiss government and the government of Brazil who have supported this work to this point. I invite other donors also to make some contributions to this piece of work. It is certainly strengthening our voice and shaping a stronger narrative about fighting and ending AIDS. I thank you very much, Chair.
Thank you, Winnie. It's now the time to break for coffee. It's great. It's 16:25, so 15 minutes makes it 16:40. We will reconvene. Thank you very much.